I'm Dr. Ruby Sehra, consultant Sri Balaji Action Medical Hospital and director of Progeny IVF Center at Punjabi Park, New Delhi. Today we are just going to talk about 10 things which you should keep in your mind before undergoing any medical abortion. As everybody knows that tablets for medical abortion are available on the chemist counter, but they are really being misused. Chemists are not doctors, and your pregnancy is a human pregnancy. Respect it and carefully abort it under the supervision of a doctor. I would like to mention that there are certain things which you should always keep in your mind before undergoing medical abortion. Number one, that never take the tablets on your own. Always consult your gynecologist or doctor. Secondly, try to recollect when did you have your normal periods? When was a normal flow of the period? Sometimes the flow is scanty in next 2 periods and you start counting when you had scanty periods. But the pregnancy started when you had normal periods. That means you had last month scanty periods, but normal periods were 2 months back. So the pregnancy will not be of the 4 weeks, it will be 8 weeks. So bigger pregnancies cannot be dealt by tablets. So make sure that you remember correctly when did you have normal periods. Thirdly, never hide from the doctor that you ever had pills. In between, suppose you had scanty pills or the pregnancy test was positive. You took the pills, but you never aborted. So this should be also told to the doctor that you had the pills but you never aborted. If you try to hide, it is going to create complications. Then you should never hide from your doctor that you've undergone any surgery, you had any complications during pregnancy or during medical termination of pregnancy, like you had severe bleeding, you had perforation of the uterus, or there was some problem during getting abortion done. This has an impact on your abortion during this time. If it was perforated, the uterus is weak. This time again, the complication can arise. So the doctor will choose whether you have to undergo a medical abortion or you have to go a surgical abortion. So never hide that you had this complication during your deliveries, during any surgery, or during last medical termination of pregnancy. As I told you, you should always consult your gynecologist before you undergo any medical abortion, so that she can properly guide you that how the tablets are to be taken and what should be the timing and how many tablets are to be taken. In market, only one kit is available. You just try, you don't know what time to take, whether it's just food related or not, and you just take the tablets like that, and you never take antibiotics after that, and you just keep on bleeding, and after 2 months you realize that next period has also not come. Now you will go to the hospital or a doctor, but then you've already landed up in complication. So always consult before taking tablets on your own. Consult your doctor or a qualified gynecologist. Then 7th point is that if the doctor has prescribed you medicine, you please take it as prescribed by the doctor and do not try to take haphazardly, because food and other things have impact on the medical termination of pregnancy. Remember, it is a painful procedure. It should never be taken when you are alone at home. You need somebody's help. If you have pain, there should be somebody else also who can help you out to take you to the doctor. Secondly, then once you've taken your tablets and you've completely aborted or not, that has to be ascertained with the help of a fresh ultrasound. That means after abortion, you must get an ultrasound done after a week or 5 days, because so as to rule out that there are no retained products of conception and you don't require any further treatment. That means if you don't get it, then if the products keep lying, you will keep bleeding, you will have septicemia, and it is going to be a big problem for you. Then never hesitate. The last but not the least, never hesitate to get a D&C done That is a cleaning of the uterus. If the products are remaining inside the uterus, it needs to be cleaned. Otherwise, you will not have normal periods. It will cause septicemia and the periods will not be regulated. If you have any further queries about this problem or any other gynecological problem or IVF related problem, you can consult Dr. Ruby Sera at Punjabi Bagh Club Road at my Progeny IVF Center, 29 North West Avenue, Club Road, West Punjabi Bagh. Or you can contact Library directly to consult.